A resident has suffered a stroke. As a nursing assistant, you've been asked to help with ambulation. The best position for doing this would be A. In front of the resident. B. On the resident's side that has been affected by the stroke. C. On the resident's side that is unaffected. D. In back of the resident. The correct answer is B. On the resident's side that has been affected by the stroke. When ambulating a resident who has suffered a stroke, always position yourself on the weaker, affected side. This ensures you are best able to provide stability and prevent falls by supporting the side that is most at risk of giving out or losing balance. When performing care activities, gloves should be worn. A. When performing pericare. B. When you are changing a resident's clothing. C. When you are feeding a resident. D. When you are helping with ambulation of a resident. The correct answer is A. When performing pericare. Activities such as pericare increase the likelihood of exposure to blood or bodily fluids. The other options have less risk for contamination. A nurse asks you to perform something stat. This means do it. A. Immediately. B. Before your shift ends. C. As soon as possible. D. Performing a stat action is out of the CNA's scope of practice and only should be done by a licensed nurse. The correct answer is A. Immediately. Stat is a term used for emergencies and when a resident's safety is threatened. The other options are not quick enough to deal with immediate safety. The best source of vitamin D is found in which of these foods? A. Steak. B. Milk. C. Apples. D. Bread. The correct answer is B. Milk. The best source of vitamin D is in the dairy food group. Part of your role as a nursing assistant is to be delegated tasks throughout your shift. In which of these examples would refusal to do a task be acceptable? A. A task that you have already done numerous times throughout your shift. B. A task that you don't feel needs to be done. C. A task that should not be done by a nursing assistant. D. A task that is not normally assigned to your shift. The correct answer is C. A task that should not be done by a nursing assistant. The only time it is appropriate to refuse to do a task is when it is something which you have a legal obligation to uphold. One case might be refusing to administer medications for a nurse. At the end of your shift, your fellow nursing assistant comes in to relieve you. While giving report, you discover your colleague is under the influence of alcohol. The best course of action, as a member of a healthcare team, is to A. Get coffee or another caffeinated drink and stay with your colleague until she sobers up. B. Suggest your colleague seek professional help through Alcoholics Anonymous or another alcohol-related support group. C. Tell the nurse in charge immediately. D. Tell the nursing assistant to go home and that you'll cover her shift. The correct answer is C. Tell the nurse in charge immediately. This situation poses an immediate threat to the safety of the residents under the care of your colleague. If you do not report it, you could be held responsible for any negligence that occurs. The other options conceal the problem and the immediate possible threat to safety. You discover a fire in a resident's room. You have gotten the resident out of harm's way. What is the next step you should execute? A. Evacuate. B. Call the resident's family to notify them. C. Use the fire extinguisher to start putting out the fire. D. Pull the fire alarm. The correct answer is D. Pull the fire alarm. The first step in dealing with a fire is getting any residents in close proximity out of harm's way. The second step is to pull the alarm so remaining occupants can evacuate. Calling the resident's family is not a step to ensure immediate safety. The other options are part of the process. Documentation of a resident's fluid intake and output is part of your role as a nursing assistant. The standard unit of measure for doing this is A. Milligrams. B. Milliliters. C. Ounces. D. Meters. The correct answer is B. Milliliters. Milliliters is the correct answer. Ounces are also used to measure fluids, but are not considered the standard unit of measurement for intake and output. Meters are used for measuring distance, and milligrams are used primarily for measuring solids. You enter a resident's room and notice he is having difficulty breathing. Your proper response should be to A. Check back in a few minutes to see if the problem still exists. B. Wait in the room for a period of time to see if it improves. C. Call the family contact member immediately. D. Notify the nurse immediately. The correct answer is D. Notify the nurse immediately. Any problems with breathing need to be reported to the nurse in case a serious problem is developing. The other response is delay immediate help. Which member of the resident's healthcare team is responsible for determining socialization and communication skills of residents and then finding the resources to match them? A. Physician. B. LPN. C. Chaplain. D. Social worker. The correct answer is D. Social worker. A social worker is the member of the healthcare team tasked with matching resident social and emotional needs to resources and treatments available. The physician and nurse execute the medical plan, and a chaplain may assist with spiritual needs. Which of these statements is incorrect regarding cleaning a urinary drainage bag? A. The bag should be kept below the level of the bladder, hip level, to prevent urine from flowing back. B. Wash your hands both before and after cleaning a urinary drainage bag. C. Avoid touching the tube or catheter ends as you disconnect them to clean the bag. D. Use peroxide to cleanse the drain on the urinary bag. The correct answer is D. Use peroxide to cleanse the drain on the urinary bag. Peroxide should not be used as it may not be readily available, nor is it adequate for cleansing. Alcohol is used for cleaning, and all of the other options are important precautions for doing this process. If you are unable to clean up a large spill on the floor yourself, what is the best alternative, once you have notified someone to help? A. Do not let any residents exit their rooms. B. Throw towels over the spill until it can be cleaned more completely. C. Ask a resident walking by to help you stop traffic. D. Block off the area from traffic. The correct answer is D. Block off the area from traffic. If the spill is large enough you are not able to clean it immediately without further equipment, the area should be blocked to traffic. Not allowing residents to exit their rooms is not practical, and throwing towels can make it slippery and more dangerous. Involving a resident is not a safe option. The nursing assistant walks in on a patient who is having a seizure. Which of these actions should the nursing assistant take first? A. Restrain the patient so the patient does not harm himself/herself. B. Call for the doctor immediately. C. Support the patient's head and move anything that could injure the patient. D. Place a padded tongue blade in the patient's mouth to keep the airway open. The correct answer is C. Support the patient's head and move anything that could injure the patient. The nursing assistant should stay with the patient and try and prevent him or her from getting hurt while seizing. Restraining the patient or putting a tongue blade in their mouth could injure the patient. The doctor should be notified that the patient had a seizure, but it is not the nursing assistant's responsibility to do so, nor is it the first action that should be taken. As a member of the healthcare team, it is important for the CNA to report certain occurrences to the nurse. Some conditions require immediate intervention. Which of these necessitates immediate reporting? A. A sudden increase in urinary output. B. Difficulty breathing. C. Incontinence. D. A decrease in appetite. The correct answer is B. Difficulty breathing. While all of these are important to document, difficulty breathing is an immediate problem and action cannot be delayed. The other items are not life-threatening and therefore incorrect answers to this question. Which of these are conditions requiring extra care regarding the resident's nail care? A. Incontinence issues. B. Obesity and irritable bowel syndrome. C. Dementia and insomnia. D. Anticoagulation therapy and diabetes. The correct answer is D. Anticoagulation therapy and diabetes. Anticoagulation therapy can cause excessive bleeding, and diabetes patients are at risk of ulceration from cuts or abrasions. These two conditions require extreme caution when administering nail care. The other conditions are incorrect because they pose little or no threat if proper nail care procedures are used. For someone interested in learning about different careers in healthcare, what is the primary advantage of working as a CNA? A. You have an opportunity to practice many different types of care roles to see which you like best. B. You have an opportunity to see several healthcare occupations and witness the role each plays in patient care. C. You have an opportunity to work with many different types of patients from varying backgrounds. D. You have an opportunity to work with many cultures and different family members of the residents you care for. The correct answer is B. You have an opportunity to see several healthcare occupations and witness the role each plays in patient care. While all of these choices provide a CNA many different experiences, the opportunity to witness nurses, physicians, and medical technicians provides the best advantage for considering future career options. The primary role of the CNA in patient assessment is to A. Assist the nurse with physical data such as height, weight, vital signs, food/fluid intake and output. B. Give the patient a physical exam and assess the patient's condition in a report for the nurse. C. Give the family members and friends an assessment of the patient when they come for their next visit. D. Provide a weekly assessment to the patient's physician. The correct answer is A. Assist the nurse with physical data such as height, weight, vital signs, food/fluid intake and output. The CNA's role in patient assessment is to report physical data and observations to the nurse. The nurse is the member of the healthcare team who makes the assessment and advises the physician. The other answers are incorrect. Which of these is true about the term care plan? A. A nurse can face strict penalties for not following the written care plan. B. All of these are true. C. A care plan is a legal document. D. A care plan promises care will be delivered as written. The correct answer is B. All of these are true. All of these are true statements about a care plan. Which of these is not true about a patient's care plan? A. A good nurse will solicit input from the CNA for the patient's care plan to make it more effective. B. A good care plan is designed to assist team members in delivering high-quality, consistent care. C. Effective care plans take the patient's wishes into consideration. D. A care plan is not necessary for every single resident in a care facility. The correct answer is D. A care plan is not necessary for every single resident in a care facility. Every single resident needs a plan of care established to document what it is being done. This is the only incorrect statement. All of the other statements are true about a care plan. Which of these best describes how accurate documentation assists the entire healthcare team? A. Accurate documentation is important, but it is more important to initiate conversations with residents under your care. B. Accurate documentation is a precautionary action to serve primarily as a means for defending a CNA's behavior should a problem arise. C. Accurate documentation is emphasized throughout a CNA and nurse's training. However, realistically, it does not happen as often as it should. D. Accurate documentation is crucial for determining if interventions listed in the care plan are effective. The correct answer is D. Accurate documentation is crucial for determining if interventions listed in the care plan are effective. Accurate documentation is for the patient. It is crucial for assessing if the care plan is working or needs adjustment. While accurate documentation can serve as a record of CNA behavior, that is not the reason for it. Accurate documentation is vital, even if it means a little less time for conversation. Which member of the healthcare team is responsible for carrying out the patient's medical plan? A. The registered nurse. B. The nursing assistant. C. Every member of the healthcare team. D. The doctor. The correct answer is A. The registered nurse. The doctor is responsible for creating the patient's medical plan, and the registered nurse is responsible for seeing that is executed. The nursing assistant assists in the delivery of care that supports the medical plan, but is not ultimately responsible for carrying the plan out. Which of these members of the healthcare team is responsible for supervising UAP, unlicensed assistive personnel? A. MD or DO, physician. B. Registered nurse, RN. C. Patient care assistant/technician, PCA/PCT. D. Certified nursing assistant, CNA. The correct answer is B. Registered nurse, RN. The registered nurse, RN, is responsible for supervising all UAP. The RN will also typically assign an unlicensed assistive staff member's duties regarding the resident's personal care activities each day. A licensed practical nurse, LPN, may assign duties and supervise UAP as well. As a CNA, you work as a team player to take care of all of your residents' needs. Which of these is a reason you should take this approach when you need to ambulate a resident? A. The resident will feel and be safer when 2 or more staff members help with ambulation. B. You don't have to work as hard if you have someone else there to help you lift a resident. C. You can move the resident yourself while your helper explains what you are doing. D. The resident can be ambulated more quickly if you work together. The correct answer is A. The resident will feel and be safer when 2 or more staff members help with ambulation. Safety of the resident is paramount in healthcare settings, and employing a team approach, especially during physical activities like ambulation, ensures that the resident is supported and stable, reducing the risk of falls or injuries. Having multiple staff members assist in ambulation can provide additional physical support and guidance, making the resident feel more secure and safeguarding them against potential accidents. Furthermore, engaging as a team ensures that if an unexpected situation arises, e.g., the resident becoming dizzy or losing balance, there are ample hands on deck to manage the situation effectively and securely. This team-centric approach not only enhances the safety and emotional well-being of the resident but also ensures that staff are not subjected to undue physical strain, promoting a safe and healthful working environment. Which of these statements about active listening is false? A. Active listening is sometimes referred to as listening with a third ear. B. Active listening is listening to a resident while doing another activity. C. Active listening is listening to a resident without being distracted by your own thoughts. D. Active listening is a skill that can cue you in on a resident's unexpressed needs. The correct answer is B. Active listening is listening to a resident while doing another activity. Active listening is an important skill that you must learn to do. It is tempting to continue to work while not giving your full attention to a resident, in order to save time. But, being able to stop, listen, fully observe and hear what your resident is communicating to you, both verbally and non-verbally, not only acknowledges the resident's worth as a human being who is worthy of your attention, but it also allows you to better understand his or her unique needs as your patient. If you have a concern about an assignment, you should A. Discuss it privately with your immediate supervisor. B. Discuss it immediately with your supervisor, regardless of who else is present. C. Complain to a coworker and ask him or her to do it for you. D. Tell your resident that you don't feel that you can properly take care of him or her. The correct answer is A. Discuss it privately with your immediate supervisor. There will be times when you may have concerns about being able to carry out a specific assignment as a CNA. The appropriate course of action is to discuss it privately with your immediate supervisor. This allows for little disruption and is respectful not only to your supervisor, but also to your coworkers and the residents.